One of the most common questions I get as a glaucoma doctor is, Doctor, will I go blind from having glaucoma? And it's a loaded question, and we're gonna get into the 5 things that you need to know about your risk of going blind from glaucoma, what increases it, what decreases it, and the statistics behind what percentage of people actually go blind from this disease. Hi, my name is Dr. Nagori. I'm a board-certified ophthalmologist and a fellowship-trained glaucoma specialist, and you're watching the iFacts.com channel. Number 1 of 5, early screening will save your vision. Early screening means that we can diagnose glaucoma in the early stages of the disease rather than in the later stages. And late stage diagnosis is associated with higher vision loss. The problem with glaucoma is that early on it has no symptoms at all. So patients unfortunately get diagnosed very late in their disease course. And at this point, they have already lost a lot of vision, and that vision is never going to come back. When you have been told that you're a glaucoma suspect, doctors like me monitor you closely for changes in your visual field, as well as monitor the health of your optic nerve. If there are changes that show that you could be moving from being a glaucoma suspect to someone who actually has glaucoma, we have the opportunity to start therapy and halt that disease progression. This can include doing eye drops or SLT laser, and there's another video on the channel all about SLT laser, so be sure to check that video out as well. Again, because glaucoma has no symptoms in the beginning, all patients over the age of 40 should have regular eye exams that include a dilation. This is the type of exam where drops are put in the eye and your pupil gets big so we can see the optic nerve. It does make your vision blurry for a few hours, and it does take a little extra time. So it does not have to be done on the exact same day as you do your glasses and contacts, but make sure that you go and schedule it either separately or at the same time. And for many of my patients, it may be more convenient for them to do these exams separately, because when you do them together, it means a really long office visit. Remember that if you have medical insurance, you can go see an ophthalmologist. Glaucoma screening falls under medical problems. So patients who say, oh, I can't get an eye exam because I don't have vision insurance, that does not mean you can't get an eye health exam. An eye health exam is covered through medical insurance, so please go get your eye health exam done. Number 2 of 5 of things you need to know to avoid going blind from glaucoma. This is compliance with medication. This means that glaucoma patients should be taking their eye drops every day and not missing a day. I have a few patients that will come in and tell me that they took the eye drop the day before and the morning of their appointment, but they had missed a few days the week before that. So when they actually come in, the pressure that I measure is not that bad because they did just take their meds in the morning and the night before. But the reality is it was probably higher earlier in the week. This means that the nerve was being damaged in the week that they missed their drops. Now, I understand taking drops can be really difficult, so you definitely need to set reminders and engage other people that can help you in reminding you to take your eye drops. But the reading in the office is not just the only important reading. Pressure that we get of your eye in the office is just one pressure reading of infinite eye pressures that your eye goes through during the day. Just like your blood pressure can go up and down, your eye pressure can also go up and down. And the medications that we give you help to stabilize it to a safe level for your optic nerve. So do your best to not skip the medications, because if you do, the nerve gets damaged while the pressure is going up. And even if you have a good reading in the office, your visual field could show signs of damage. This is also why the visual field test in the office is so important, because it helps us to see how the vision has changed over time. Number 3 of things that you need to know. So the third way to keep your vision when you have glaucoma is to show up to your appointments. And of course, life happens, things happen. You may need to cancel and reschedule. The doctor may need to cancel and reschedule. So it's just important that you take the initiative to make sure that that appointment has been rescheduled within a timely fashion. I would say that's at least within a month of your original appointment. Remember that if for some reason your doctor cannot see you, or your doctor has moved, or your doctor has gone on maternity leave, make sure that you schedule with any other doctor in the practice, because most ophthalmologists are more than capable of doing a visual field exam and getting a reading of your eye pressure. There is no way for a glaucoma patient to know at home if their glaucoma is progressing. Even when patients have medications and they take all their medications properly, sometimes glaucoma can become more resistant to their existing medications over time. So the same way that patients who have high blood pressure sometimes need a second or third medication added on to control their blood pressure, glaucoma can be the same way. This is why follow-up is so important, because we want to make sure that the therapy that we've put you on is actually continuing to work for you. And if it's not working, then what else can we do? Do we need to add another eye drop to keep your eye pressure controlled? Do we need to do SLT laser? Or do we need to do glaucoma surgery? So there are a lot of questions that we ask and answer during these visits. So the eye appointment is not just about your eye pressure, but it's also to check your glaucoma testing, make sure it looks stable, make sure it's not progressing, because if it is progressing, something else needs to be done. Number 4 of 5 things that you need to know to keep your vision if you have glaucoma. So glaucoma is not an isolated disease, and the eye is not an isolated organ. Keeping your body healthy is also so important when it comes to glaucoma disease management and glaucoma control. Patients ask what type of things that they can do to help with their glaucoma, and the answer is actually pretty simple. What is good for your body is good for your eyes. The eyes are an organ in the body, just like all the other organs in your body. The eyes need oxygen, and things like eating healthy and working out can help your body and your eyes. Also, managing your other chronic diseases is really important. So if you have sleep apnea, it is important to treat your sleep apnea, not just for your lungs and your heart, but also for your glaucoma as well. Likewise with diabetes, or if you are overweight. Eat nutritious foods, stay active, and check in with your regular doctor to make sure that your general health is optimized. Now, number 5 of 5, and this tip may seem strange to you, but I think it's really important. My 5th tip to keeping your vision when you have glaucoma is to trust the science, but if you feel unsure about it, or you feel unsure about your care, then definitely do not hesitate to get a second opinion. I have been treating glaucoma for over a decade, and there are many patients that feel unsure about the treatments that are being recommended. I don't want my patients to lose vision and go blind, so I always recommend that if they are unsure about proceeding with treatment, that they go to a second or third glaucoma specialist to get their opinion as well. If a patient of mine is unsure about starting therapy, I have no problem with them getting a second opinion, because I want them to be on board with the treatment. There's nothing wrong with having more than one doctor involved in your care. Glaucoma is a lifelong condition, and it really requires buy-in from the patient, and the patient needs to be on board with getting treated. Some of the worst outcomes that I have seen when patients go blind from glaucoma is usually when patients refuse the treatment or don't trust the doctor, don't trust the treatment, and this can lead to missed appointments and non-compliance with medication. So if you feel unsure or uncomfortable with your glaucoma diagnosis or uncomfortable with the treatment plan, get a second opinion so that you can feel confident. Another glaucoma specialist would be a great idea to help you feel better about going down a treatment path. Now let's talk about the statistics. So when it comes to going blind from glaucoma, over a 20-year period, 13 to 16% of patients who have glaucoma will lose vision in at least one eye. Losing vision in both eyes is less common, and that rate is about 3 to 9% of patients with glaucoma. Good news is that the risk of blindness from glaucoma has dropped significantly over time. People diagnosed in more recent decades were about half as likely to go blind compared to those patients diagnosed in earlier decades. This improvement is mainly due to an earlier diagnosis and the advancement of glaucoma research, which has led to earlier diagnosis as well as better treatments. People who are at higher risk of vision loss from glaucoma are patients who are diagnosed late in the disease. This means that they already have significant vision damage at the time of diagnosis. They have higher eye pressures in general. They may be older at the time of diagnosis, and those patients whose eye pressure is just not well controlled over time. Patients who progress to blindness typically started with more advanced disease and lost vision faster than others, even when treatment lowered their eye pressure. This is why screening is so important. You need to catch the disease early. What questions do you have about glaucoma? Drop them in the comments below and I will do my best to make a future video about it. Hope you found this helpful. Remember to hit like and subscribe, and thanks for watching.